Hello, and welcome to our webinar series, Candid Conversations on Health. Throughout the year, we will tackle a variety of topics related to our health and wellness. The focus of today's webinar is Suicide Prevention Awareness Month. This webinar is being done in collaboration between LDH's Bureau of Community Partnerships and Health Equity and the Office of Behavioral Health. If you or someone you know is struggling or in a crisis, help is available. Call or text 988 or chat 988lifeline.org to reach the Suicide and Crisis Lifeline. My name is Ayana Usri, and I am the support coordinator for the Louisiana Department of Health's Bureau of Community Partnerships and Health Equity, also known as BCPAP. The Bureau of Community Partnerships and Health Equity is devoted to increasing the citizens of Louisiana's knowledge about what affects our health, especially for those in particularly vulnerable communities and populations. This devotion is rooted in raising awareness through webinars like today's and partnering with stakeholders in the community to move toward a healthier Louisiana. At this time, it is my honor to introduce Dr. Ashley Jefferson, Louisiana Department of Health, Office of Behavioral Health, who will share a few welcoming words. Dr. Jefferson.
Thank you, Ms. Usuri, and thank you to everyone who is in attendance. Also, thank you to our panelists and to those who have organized and put this on. As you know, this is a very, very important topic to talk about, as most of the topics or all of the topics are that we do discuss on these webinars. But this one in particular is very, very important. We have spoken a lot about disparities within certain communities, and today this topic is one that great efforts are going on throughout the state and the nation as a whole to combat the risk and the prevalence and even the completion of this topic. So we do have some highly esteemed individuals who are moderators and panelists today. And so we are very, very happy to have these professionals here to speak with us and speak to us. Sorry, there's some background noise there. I won't belabor the point and take a long time, and I won't give you a lot of figures and a lot of stats because I know that our panelists will be making sure to touch on a lot of those things. But I do want to tell you that, you know, suicide affects people all over the world, and each death has very far-reaching effects. We do have resources, and here at LDH, we do implore you to reach out to us directly. We have an open communication policy with anything regarding health, and especially with topics such as suicide, behavioral health, or any type of other health issue. It is estimated that 1 in 18 people are affected by someone else's suicide also. So it's important that we think about our neighbors and that we actually provide those resources to them also. I will tell you that this topic is so important that there are several holidays or several observances that occur just so that we can bring awareness to this topic. For instance, September is Suicide Prevention Awareness Month. And in the month of September, there's the National Suicide Prevention Week. And there's also the World Suicide Prevention Day. So like I said, this is a very, very important topic, and we're happy to have you here. We'll talk more about it, but there is a 988 line that I'm sure Dr. Thomas and some of the other panelists will be able to speak to more. But one thing that I do want to leave you with is asking you and imploring you to make sure that you research for yourself, that you become aware and knowledgeable about this topic, and that you reach out should you need any assistance with helping to understand or any other resources, because this is something that impacts us and our communities as a whole. And so we just thank you for joining us today. And I'll kick it back off to you, Ms. Usher.
Thank you so much, Dr. Jefferson. So now I'll go over a brief overview for today's event. So we're doing our intro and welcome right now. We'll go over our facts related to suicide prevention. Then we'll have our panel discussion and we'll go over those key takeaways once more. So the objective of this webinar today is to increase awareness about suicide, discuss the warning signs, risk, and protective factors associated, as well as societal issues that contribute to increased risk. So our first fact, suicide, as Dr. Jefferson mentioned, is a serious public health problem that can have lasting harmful effects on individuals, families, and communities. Suicide also occurs across all age, gender, socioeconomic, racial, and ethnic groups. Suicidal behavior is complex and usually not a response to one problem that a person is experiencing. Some risk factors vary with age, gender, or ethnic group, and may occur in combination with one another or change over time. And last but not least, suicide is preventable. Knowing the risk factors and recognizing the warning signs can help to stop it from occurring. These 4 facts are ones that you will hear throughout the webinar today. I want to stress the importance of getting information from trustworthy sources. So if you're going to share suicide prevention information with loved ones or within your communities, please only use information coming from websites like the Louisiana Department of Health, the CDC, and the like. We will provide you with a one-pager via email after this session to aid you in how to share suicide prevention information. Sharing accurate information can help save lives. And now it is my pleasure to introduce the Director of the Bureau of Community Partnerships and Health Equity, Devondra Brown.
Thank you, Ms. Ussery, and thank you all for joining our Candid Conversations on Health Suicide Prevention Awareness Month webinar. Before I turn the session over to our event moderator, I want to thank each and every one of you for joining today's conversation. I hope that you find today's discussion informative and helpful. Here's some helpful information for people with Medicaid insurance. If your medical insurance coverage is from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the self-service portal at www.ldh.la.gov/mymedicaid, or you can call 1-888-342-6207. Now, to today's moderator. Today's moderator is Dr. Robin Thomas. Robin Thomas has a PhD in industrial organizational psychology, a master's degree in mental health counseling, and a bachelor's degree in psychology. She is a licensed professional counselor, licensed marriage and family therapist, and nationally certified counselor. She is also a mental health first aid instructor. Robin has over 21 years of experience in state government, which includes 16 years of experience working with various departments within the Louisiana Department of Health, such as the Office of Behavioral Health, Office of the Secretary, and Office of Public Health. She has over 17 years of experience conducting comprehensive mental health and substance use assessments using a trauma-informed approach in a hospital emergency department. She has provided crisis intervention to various ages, such as children, adolescents, adults, geriatric patients, and their families in a hospital setting. She has worked with several populations, including individuals identified as having severe mental illness and exposure to traumatic stressors. In her work, she has had the opportunity to provide crisis interventions to some of the most vulnerable populations in Louisiana. Robin is dedicated to providing crisis interventions and striving to improve behavioral health systems and outcomes for the citizens of Louisiana. She is currently employed in the Prevention, Wellness, and Workforce Development Team with the Louisiana Department of Health Office of Behavioral Health as the State Suicide Prevention Coordinator. She provides and coordinates evidence-based training in suicide prevention and intervention. She is also responsible for overseeing the implementation of a statewide suicide prevention plan, which includes the implementation of zero suicides in the behavioral health systems and state behavioral hospitals. So with that, it is time to begin such a needed discussion, which is extremely timely in my case, because recently the city of Baton Rouge and our church parish lost a beloved parishioner to suicide at the age of 19. We don't want to lose any more lives. So we really hope that all of the participants tonight listen and care for each other. Reach out with this information, share it far and wide, and please make sure to take care of yourself. With that, Dr. Thomas, I will give you the floor.
Thank you, Dr. Jefferson, Mrs. Brown, and Ms. Ussery for starting today's event. For each of you, community members and stakeholders who took the time out of your very busy schedules to attend this important discussion, thank you. In this webinar, our hope is that what you hear, you find useful, empowering, and encouraging. We want you, the audience, to leave this conversation empowered with the knowledge to understand various aspects of mental health. We have trusted gatekeepers from around the state who will lead and be part of this discussion. Before we go any further, let me do a brief introduction of our panelists. Brian Turner, PhD, is a native of New Orleans, Louisiana, and completed his undergraduate studies at the Southern University at Baton Rouge. He completed his doctoral studies in clinical psychology at Jackson State University. Dr. Turner currently serves as a licensed clinical psychologist in private practice, Moments of Truth, LLC, a tenured associate professor in the Department of Psychology at Xavier University of Louisiana, and he serves as the director of the African American Dysphoria Studies program at Xavier University of Louisiana. Dr. Turner's work as a professor and clinician is grounded in his multicultural training, which examines the impact of culture on mental health. During his time at Xavier University of Louisiana, his research has focused on Black male experiences in higher education, Black women in risky behaviors, and mental health in HBCUs. Dr. Turner is a proud father of the intelligent and beautiful Blair Layla. He is also the daddy to Von Duke Bailey Turner, a full-blooded German Rottweiler. Dr. Turner previously served as a board member for the National Alliance for Mental Illness, Louisiana, NAMI, Louisiana, and Encore Academy Charter School. He currently serves on the board of the TRIM Education Program. And Shauna Sias, LPN, is a healthcare professional with over 25 years in the medical field, ranging from geriatrics, juvenile justice system, and corrections. Shauna took all of her years of hurt, ridicule, bullying, mental trauma, drug addiction, inadequacy feelings, and with the help of her best friend of 45 years, created a bullying and suicide prevention curriculum. It encompasses not only the mental health aspect of bullying, but also incorporates empathy, which is the fundamental necessity of nursing, but also one of the fundamental missings in today's youth. She has given over 200 hours of community service to various schools throughout the state. She and the #BullyBox team serve as gap fillers between the community and law enforcement in the capacity of cyber safety. Shauna describes #BullyBox as her life's purpose. She takes her life experiences, lessons, successes, and mistakes, then presents them to the youth in an age-appropriate manner in an attempt to show them that it's absolutely okay to be you on purpose. Shauna desires to eradicate bullying and suicide. She desires to empower every child into believing that they are enough and that tomorrow gets better. She encourages people, adults and children alike, to sing their own song, write their own lyrics, dance their own dance, be their own rhythm, choose their own colors, color outside the lines, turn every page, walk in the purpose, and to remember that they do not live once, they live daily and die once. Danita LeBlanc, LCSW Bax, has worked in suicide prevention and intervention through her career. She is a licensed clinical social worker and a board-approved clinical supervisor. She retired as the state suicide prevention coordinator for Louisiana in December of 2019. She is the board president of the Louisiana chapter of the American Foundation for Suicide Prevention. She is also a certified trainer of the Applied Suicide Intervention Skills Training Assist, Safe Talk Suicide Alertness Training, and Mental Health First Aid for Adults training. In addition, Ms. LeBlanc has more than 30 years of experience of clinical and administrative work in mental health. This includes experience with crisis intervention, inpatient psychiatric units, psychiatric triage in an emergency department, and behavioral health in state government. She has worked in disaster behavioral health, trauma and crisis intervention during numerous natural hurricane and flooding disasters in Louisiana. Avis Brown, LCSW Bags, previously televised on NBC News affiliates, discussing ways to deal with stress and anxiety, is a licensed clinical social worker, board-approved clinical supervisor with 30 years of experience with adults, children, and families. She has extensive experience in working with survivors of sexual trauma. Avis is the owner, founder of Victory Unlimited, LLC. In addition to providing clinical services, she is a self-care coach, specializing in self-care and wellness for professionals in high-pressure positions. She self-published Ignite, the Sassy Self-Care Planner Journal, Sage Scripts, the 30-Day Affirmation Coloring Book, Silver Lining Self-Care Plan for Youth Workbook, and an ebook, Girl Grieve. Avis earned a Bachelor of Science from Southern University and A&M College in Rehabilitation Counseling and Master of Social Work from Tulane University. She has extensive experience working in state government, providing direct care and administrative duties. You can catch a week podcast, Sanity Saving Self-Care, on Apple, Google, and various other platforms. Victory Unlimited LLC can be found on Facebook, as also at Coach Curator on Instagram, YouTube, and TikTok. And these are our panelists. They are going to help us have a brief but deeper discussion. As we start this panel discussion, it's important that we continue to remain vigilant in the fight toward pursuing a healthier Louisiana. This discussion will be factual, based in science and understanding. Let me be the first to say, as the moderator of this session, that people have the right to feel what they feel regarding their past and present experiences of racism, sexism, mistreatment, or injustice. We know these experiences play a part in people, populations, and communities. Trust in the healthcare system. So let's get this panel discussion started. So the first question I'll ask the panel, what is your profession and how is it related to suicide prevention?
I'll go first. Good evening, everyone. I'm a licensed practical nurse. I am in the teaching capacity right now. Before I was with corrections as well as geriatrics. And suicide prevention is part of mental health. So it's always and should be part of every job, whether it's nursing, psychiatry, medical, Walmart. You know, where people are, there's always a link to be able to help.
Thank you.
I'll jump in.
Okay.
I saw you, Avis, getting ready to go, but I'm gonna beat you to it. So as a professor of psychology, a lot of the work I do is preparing students who are looking to pursue a field of the mental health care field. So the idea of discussing suicide prevention and the impact of suicide is a standard kind of issue across the curriculum. But also as a clinical psychologist in my practice and in my training, understanding the impact of stress and trauma on individuals and the potential disposition to suicide has been very important. So my work as a professor and as a clinician are tied right directly to the prevention of suicide.
And I'll also say that my work, just my private practice work in working with adults, but particularly group work that I've been doing with youth, teenagers particularly, teaching them something I've learned in working in high pressure positions as a provider, providing care, is that sometimes the very people that are giving the most and doing the most aren't doing the necessary work ongoing to effectively decompress in the right way. So what I have really, but it's become a passion for me, is the Silver Lining Self-Care Plan for youth is teaching them what real self-care looks like, so they can begin at a very young age developing the proper habits and healthy habits and ways of thinking and coping that will help to carry them on. And it helps them to deal with stress better. It helps them to recognize triggers as related to trauma. And so that is a way of suicide prevention as well.
That leaves me. So social work has an emphasis on the person in the environment. And my specialty was in mental health. And that also came to encompass suicide prevention and crisis intervention. But suicide prevention is a public health issue, and that is an aspect of social work that I think gets overlooked sometimes. Is it's not just the individual with mental illness or the individual that has dysfunctional families, but individuals who think about suicide don't exist in a vacuum. So there's multiple levels that suicide can be addressed on. So it fits.
And Dr. Turner, I'll ask you first, what groups are at the highest risk for suicide in the United States?
So this question is really very interesting, because I think folks like to think that one group or one set of individuals may be more at risk, but the reality of it is that anyone is at risk of suicide. When we look at the statistical kind of analysis, we find that the trend across individuals who attempt suicide or commit suicide is trauma. And it is the direct experience of some type of traumatic experience. However, one individual cannot predict how much a traumatic experience may affect another individual. So we think about across age groups, and so from young adults to older adults, we think about across demographic groups in terms of sexual identity and sexual orientation, and we see that there are different rates of suicide. But I would be remiss if I was to say that one group per se was at a higher risk. I think the reality is that any person who experiences trauma, psychological distress, or any factors that may cause a person to begin to experience significant mental health crises, that would lead someone to become at a higher risk. So I don't want to make it sound like, oh, if you're Black and male, you don't have any risk factors, because Black men are at risk for suicide. The reality is that certain groups do have higher rates, but I want everyone to leave tonight understanding that any individual who potentially experiences trauma, and that trauma is going to be defined by that individual. And I think that's the other reality, is that it's not the trauma that Brian experiences, right? It's the trauma that that person experiences, and what in effect taxes that person's resources to the point that suicide becomes an option, because suicide is not a mental disorder action. I think some people miss that. It's the outcome of the result of what people experience as they experience a mental health disorder.
I agree. I agree 100%.
I was gonna interject. That's some awesome points. I think as a nurse, two things. Not necessarily a age group or a gender and ethnicity. It's just that it may happen in numbers per capita, right? It all depends on who's counting, really, okay, and who's being included in the number. Okay, so that's first. The next thing, it kind of falls in line with the reason it's kind of shied away from. No one wants to, say anything. It's kind of because it comes across as something that's flawed or weakened. No one ever wants to come out and say, hey, I'm weak. No one says that, right? And I think it's not so much the group. For me, it's now the age. Pain is what a person says it is. As a nurse, that's what we're taught. If someone comes in and say, I hurt, you don't say, well, it didn't hurt me, or I didn't feel like that. It has nothing to do with you. And that's part of the reason why I try to explain to people why empathy is so important. Empathy is not me saying that I know how you feel, because there's 3 different types of empathy, and each one of them kind of fall in the age group. So I think for me, it's just people don't take into consideration that it is what the person says it is. I think that's missing.
And Danita, what type of behaviors or warning signs would you say for suicide?
There's several that people can look to, one of which is just a drastic change in behavior for the person that you know or that you care about. We talk about warning signs of things that are illnesses, but I like to think about them as invitations to help, because people are trying to let us know that they need help in the best way that they are capable of asking for it. And if I think about the signs of distress that might be indications of somebody thinking about suicide, if I think of them as they're inviting me to help, it's much easier for me with a loved one or a coworker or even someone I don't know well. It's much easier for me to accept the invitation if I look at what I think someone is feeling, some of their actions, some thoughts, some of their situation, some of their physical changes. So a lot of emotions kind of go with suicide. So some of those are like real extreme mood swings. The trifecta I think about a lot is hopeless, helpless, and worthless. And helpless in terms of nothing I do to fix this is working, hopeless in terms of nothing anybody else can do, and worthless in terms of not being worth anybody's time to help me get out of that hole. But feeling alone, guilt, shame, the sense that no one cares, the sometimes prone to angry outbursts, tired, apathetic, numb, are all emotions that have been associated with suicide. Some of the behaviors that you might see are declining work or school performance, with youth and young adults giving away prized possessions, well, more like writing a will for older adults, making arrangements for their end of life. Might see people withdrawing from things that they normally like to do. Might be careless about their personal appearance, or their physical appearance may deteriorate over time. So all of those behaviors might be signs to us that they're inviting us to help. The kind of comments that you might hear are threats, sometimes like direct threats about wanting to hurt or kill themselves. A little more vague sometimes is just focus and a lot of discussion or art around death and dying. Some things sometimes of, I wish I wouldn't wake up. I wish I could sleep forever. Life's not living. Other people would be better off without me. You'll be sorry when I'm gone. Nothing I can do to change anything. I'm better off dead. Not having meaning in my life. I don't have any purpose in my life. So those kind of comments are either very direct, I want to kill myself, or they're a little more vague. And so both the behaviors and the words are things that we need to pay attention to. One of the things that happens with thoughts is that they can become constricted and they almost aren't thinking clearly. And the only option they can see is suicide at the end of that tunnel. Also, for many people, the sense of being a burden. I've talked to many suicide attempt survivors who say they were absolutely positively convinced that people around them were better off without them. And they couldn't see any signs that that wasn't the case. Feeling the trapped conversations and no way out, not being able to make decisions, those go with some of the thoughts that someone might be experiencing. And the situations, there's often a recent crisis, but suicide's one of those things that's very democratic. And so anytime someone's in a situation where they're in a lot of pain and they've had a loss that's real important to them and they're feeling alone, those situations are really high risk factors when they all occur together. You may also see some physical signs like changes in eating or sleeping, reckless behavior, increase in substance use or gambling or use of food to kind of help with mood. Some of those are signs of mental illness, not all of them are, but you probably also see some physical changes. And so think about their feelings, actions, behaviors you see, comments they make. See if you can get a sense of the thinking that they're experiencing, learn about their situation, and be observant about changes in their physical manifestations.
And while we're talking about warning signs, Avis, we know while there's no singular determining cause of suicide, what are some of the risk factors associated? I know, Danita, you might have touched on that a little bit, but Avis, did you have anything to add to that?
I did.
About risk factors?
It's particularly when she mentioned the burdensome, and it's really the perception of being a burden.
Yeah.
It's a perception that's really distorted that comes from that. And this comes from the suicide notes that people who were successful left, and then also the ones who attempted and survived. But it's the perception of burden, of being a burden, to where the overwhelmment of the depression distorted their thinking in an irrational way and weighed on them so heavy that it made a situation that felt heavier to them, to make them feel that that was the only relief that they could have. And because of the isolation, that's something that the more they isolate, then they're detaching from people that are more familiar with them or that would engage them to try to do activities that could even elevate their mood. So then they're just kind of left marinating in this distortion. And if it becomes too much, and if they are able to muster the energy. So, some of the risk factors, and, I agreed with Dr. Turner in that it really doesn't look per se, ethnically or anything, although they say, okay, white, American Indian males, older age separation or divorce issues or early widowhood, but it's also the risk factors are people who have attempted in the past. If there's a personal history, if there's a family history of suicide attempts or successful completion, history of violence, trauma, being huge, mental illness, exposure to the death of a loved one, and the ineffective coping that comes from just the grief and bereavement process. Sometimes it could be a risk factor could be perfectionism, particularly when it's related to depression. I spoke of the isolation, persistent nightmares, hallucination. People who experience command hallucination or hearing voices telling them to harm themselves, those are some risks. But just the disconnectedness or sense of purpose and meaning, those were also some things that Danita mentioned as well. So the risk factors of a lot of variables and compounded with the inability to ask for help, feel a worthiness. And again, it goes back to the whole concept of that self-care, which when I'm not talking about manis and petties, I'm talking about your self-love journey and the ability to feel like you're worthy and deserve to be your biggest fan. Like a lot of times sometimes people who are the most downtrodden, they could give somebody else encouragement because their sense of worth, they don't feel like they deserve that same thing. So not having that inner love and acceptance for yourself, and then if you're not getting it from somewhere, those are some risk factors.
And Avis, I know, would you be able to explain for the audience the difference between suicide, suicide attempt, and suicide ideation?
Okay.
Just for clarity for the audience.
Just for clarity, suicide is when someone actually takes their own life, and it's the result of that deep depression, overwhelmment, and hopelessness. A suicide attempt is a deliberate attempt to end one's life that is unsuccessful. So it's not the same as sometimes there are situations that people indulge in risky behavior and it can come across like they were attempting suicide, but it wasn't deliberate. They were actually trying to do something else. And then an ideation is prevalent, like reoccurring, persisting thoughts of wanting to end your life. And I would go further to say, with those ideations comes planning and preparation to do that. And it's to the point where you think about how you would do it, all of the circumstances, the day, the time. You might even consider how it impacts certain people. So you start getting the material of the items, and you've made a resolve that this is something you want to do. And the ideation is not, and it's not the same. Like sometimes people just get down. Let's just be honest. If we're going to be very honest, we're in a time so much has happened over the last couple of years with so much uncertainty. People have been really frazzled, and with unemployment and just the changing of family dynamics, work environment, family dynamics, family members who have just suddenly died because of just things in situations we can't control. Sometimes people have expressed feeling like, I don't want to be alive. I don't want to live anymore. And it's pretty kind of natural to get to a point sometimes, depending on different issues of life, it's down. There's a difference between when you're truly entertaining the idea of ending your life and making a permanent decision about a situation that is really a temporary because you're not able to see beyond the circumstance.
And Dr. Turner, if I can ask, what is mental health stigma and how does it affect suicide prevention?
Thank you for the question. So we know historically mental health stigma has been the prevalence of the idea that certain persons avoid or have negative perceptions of mental health issues. So the ideal that people just simply don't want to admit, acknowledge, or experience mental health disorders. And when we think about suicide ideation, what that really means is that people will oftentimes avoid the very existence of the things that might be leading them to the thoughts of potential suicidal ideals and ideation. So what I would say is that when we ignore our mental health and taking care of ourselves, that's what we actually once again begin to increase the potential for suicide and suicide ideation because we're not paying attention to the things that don't feel good. And so the idea of stigma and what happens and what really occurs is that people miss out on taking the accurate steps. And as a couple of my panelists have said, it really becomes important for us to promote resources and make sure those resources are available so that people understand that mental health care is normal. It's a component of everything that we do every day, and that there's nothing wrong seeking help in those times of need.
And Danita, as a certified trainer in various trainings related to intervention skills, our audience today may be wondering if a person they know seems troubled, is it safe to ask if they are thinking about hurting themselves? Can asking increase the suicide ideation?
It is absolutely okay to ask people directly about suicide. One of the things that does is it lets the other person know that you're willing to talk about it. It's not a subject that's taboo for you. We fear that if we ask about it, we're going to put the idea in their head, but that idea is already there. When we ask about it, it gives them a chance to talk about it and kind of get it out of their head in a way that may have been kind of running round and round. There is absolutely no evidence that asking about suicide plants an idea in somebody's head. There's a growing body of evidence that asking is helpful. And even saying the things that you've noticed about in the person, things they physically or verbally said, or you see, or you know about their situations. But I've noticed these things about you. Sometimes when somebody experiences these, they're thinking about suicide. Are you thinking about suicide, killing yourself, taking your own life? It can be that direct.
Shauna, is suicide ever related to impulsiveness?
Absolutely. Because again, impulsiveness and pain, they don't go well together. When a person hurts, they hurt. So it's not that they're at that particular time wanting to die or wanting to kill themselves. They're wanting to stop the hurt. And depending on the age, and not necessarily the gender, I deal more with age because young people are doing this at more alarming rates than I've ever seen in all of my life. Just in my the last 2 weeks, we have gotten 5 emails on children who wanted to seek bully box help after they got out of their 7-day, they call it their 7-day stint at Vermilion, right? It's not because they want to die, because that's the first thing they'll tell me. I didn't want to kill myself. I just wanted them to stop. I wanted them to leave me alone. But being able to process those things comes with age, right? It also comes with higher order thinking. You have to be able to process certain things. And sometimes us adults aren't able to process that. So children are absolutely impulsive because it's not that they want to die. They just want to not hurt. They don't want to be shamed, or, like they say, they don't want nobody playing on their top. They don't want any of that. And I think a lot of it is it's a generational gap. We don't even understand the language. I've sat in the room of kids and they will say, man, go kill yourself. But the way that they're saying it in their conversation, they're Joseph, you see. But if someone older might hear that, I'm looking at 2 of the panelists' faces, they're like, that's not acceptable. And it depends on their clique, their rapport, their relationships, and it's become big because we never really fully identified what it was that was leading to suicide. I can speak personally about suicide. I've attempted suicide at least 4 times in my life. 2 of them being me as a kid. And my parents were both there. I had loving home, working parents, married, 5 of us, school teachers. They were present all the time. That didn't mean anything. That didn't mean nothing at all. So I understand personally how you may not want to be in the situation, but it doesn't necessarily mean that you want to die either. Sometimes you just need to say something to get somebody attention, and that will get the attention. But I think the gap is needing because children might say it to get the attention, but then we're not giving them the help that they need to give them a protocol. Or you're going to go to Vermilion for 7 days. You're going to go here for 7 days. And when you come back, your guardian or your loved one or whomever is supposed to follow up with this one. Well, that's not working. That's not working. We don't need to just address it once they've fallen to pieces. Bullying is directly linked to suicide. It should be fed and taught just like English, math, social studies, football, and basketball.
May I add to that?
Yes.
When studies were done of near lethal suicide attempts, so people that almost should have died from their suicide attempt, like jumping off the Golden Gate Bridge, but they didn't die by their attempt. And when they asked them, how long was it between you firmly decided you wanted to kill yourself and taking action? 24% of the time, it was less than 5 minutes. And 47% of time, it was less than an hour. So one of the overall things to do is help make their environment safe and put some time and distance so that the impulsiveness is less likely to result in their death.
Yes. So, Danita, if your loved one shares their suicide ideation with you, how should you respond? What actions should you take next?
I would say absolutely, positively first, you take a very deep breath because it's scary when someone tells you they want to die by suicide. And remember that very often if they're talking to you, it's a good sign because that's the part of them that wants to live. So take a deep breath and be prepared to act in a calm way, even if you may not be feeling super calm, but responding in a calm way. And to be very respectful in interacting with them. But what we can do is we can ask them directly about suicide because it lets them know it's okay to talk about it. We can be there with them. Don't leave them alone. They already feel alone. So connecting with you in the presence is kind of a hopeful process that they might be able to do that in the future. So be there with them as much as possible. Keep them safe. So ask them, have you done something already to hurt or kill yourself? When you say you're thinking about suicide, how are you thinking you might kill yourself? Information on how or when or where. But whatever their method is, put some time and distance between what they're thinking of using to kill themselves and their ability to act on it. Most of the time, people aren't able to think of another way to kill themselves. And the suicidal crisis doesn't always last forever. It kind of ebbs and flows for some people. So once it passes, they may not have the thought come up again. They might, but you can work with them on things that they can do in the future. Help connect them to the lifeline, the 988 lifeline, or the crisis text line, or the Trevor Project for LGBTQI+++. Help them connect to someone who can help them. Sometimes maybe helping them figure out who their insurance would cover, or get a recommendation from the doctor, or know if your area has mobile crisis teams. So help them connect and then follow up. That caring contact, text, memes, the thinking about you, hang in there, those types of messages can increase connectiveness and it conveys that you matter to me. So ask, be there, keep them safe, help them connect and follow up.
And I'd like to add, sometimes if you don't know what to say, just don't say anything, because saying the wrong thing could be equally as bad. Okay, and make them feel safe, but don't make them feel inadequate. You know, don't make them feel like this is some curse or some nasty disease or something. It is an emotion, and emotions do not last always. They are temporary. It's kind of like when you're traveling and in the spot that you're in, it's pouring down raining, but just the few little steps above, the
Yeah.
sun is shining over there and people are having picnics outside. So it's just kind of sitting with them to get them, to help them through it.
Yep.
I wanted to definitely piggyback on that. I like too how Danita was saying, you know, not to be shocked, like prepare yourself when you hear it to be very present. You've got to put your stuff on the shelf so that you can, it's not even about what you're gonna say so much as being there to listen and say, you know, how can I help you? What do you need from me? So that you never know what's gonna come after that. And you want to hear really more of what's going on inside. The great news is that they shared that, they got that out. But just being prepared, to hear and be present for whatever else will follow, and being a support for them to get to the help they need, you know, after that moment.
And definitely don't take it personal. Because I know when my daughter at one time, who's now a freshman at Grambling State, she was going through an anxiety and very down, dark depression, to where we had the cutting and all of that. And when she told me about her wanting to commit suicide once, I immediately thought I had failed, that it was something I had done. And it takes away from what the focus should be. So her experience not only taught me how to handle going forward, but how I had mishandled it before. You know, and which is another thing Bully Box does on the website. We made sure to link 988, because sometimes you don't know what you're going to run across on the internet, social media. Someone should always be able to access the help that they need, even if they don't want to get it from you. They can get it through you.
And I want to ask Dr. Turner, Dr. Turner, throughout the last few years, there has been a noticeable increase in the suicide deaths of Black Americans. What's driving this?
So yeah, that's a great point that we look at, and definitely as my co-panelists have talked about. One of the issues that seemingly comes to bear at this moment is the fact that whenever people are experiencing loss and grief, and specifically death, it actually causes us to think about our own mortality. So when trauma is around, other people experiencing loss and grief, it actually becomes a central theme for our own selves to become introspective and to think about, and to almost at the very like natural or almost unnatural points to consider, what am I doing with my life? And so what I think about is that in a very real way, we have to be honest that talking about suicide does not increase suicide. Talking about suicide does not increase suicide ideation. Actually, research supports the notion that when we talk about these things and when we find ways to help people understand why they may be thinking about these things, they actually become more likely to reach out and seek assistance. So we know, especially in communities of color and communities that are historically marginalized, historically misserved, underserved, misdiagnosed, underdiagnosed, mistreated, untreated, not treated, and can't get treated, that we have some buffer. So earlier we talked about this a little bit, but churches, civic organizations, faith communities, various organizations, our Greek-led organizations, in New Orleans, once again, some of our Mardi Gras crews and our masking crews, these are places where we need to have these conversations. Our city in New Orleans has started an initiative of using barbershops and hair salons and other places to talk about mental health stuff. We have to normalize this. So to your question, the reason why we've seen this uptick, I think the reality is more based in the fact that we've actually seen African Americans having to endure traumas that we didn't think we'd have to see again.
Mm-hmm.
So when we think about the constant
Yeah.
violence on our news and social media, we have a president or a former president who openly espoused threats of violence to individuals of different communities that were Black and brown and LGBTQ and immigrants. And we have governors who are still playing these games. It causes individuals in these communities to once again think about their own mortality, to have to consider what is happening every day that's a threat to me. And so I think what we see is that we have to be honest that these things happen and they're not happening in a vacuum. And what it does is it causes individuals to have to think about, how will I exist every day? And if I have to think about how I exist, that means I have to think about how I may no longer exist. So even as Dr. Brian Turner with a PhD and a nice little house, a nice little car, I have to consider, when a police officer stops me, how might he respond to me? That can become one of those resources that can tax me, or that becomes an event or issue that taxes my resources to the point where I may no longer have enough one day to deal with that. And so when we think about persons in our communities who are on the lower spectrum in terms of SES and in terms of cognitive abilities and emotional abilities, and those who've been traumatized and hurt and harmed, that's why we've seen the uptick, because it's causing people to have to ask that question, how am I living every day and what is it worth? And so we see things like the pressure and you know, if you on social media, we see the increases of children having outbursts in schools, and we see them acting in negative ways upon teachers and even their parents, and then their peers. And then we think about what's happening in communities. So the point is, Black people experiencing just as much as everybody else, if not more. When you think about it, the insurrection, when you think about it, the war in Ukraine, when you think about police brutality and negative experience in our communities, you think about the pandemic, you think about monkeypox, all of us need to take a time and really, as Sister Dignity said, breathe. And we need to talk about what's going on that causes us to feel like we are being taxed.
Right. And I know, Dr. Turner, you've made some very good points. I know you mentioned trauma. What is a protective factor? And this is to Shauna too. What are some examples of this as it relates to suicide prevention? Can we talk about protective factors?
So for me, the biggest protective factor has to be that our communities can no longer pretend like mental health issues are not important. And I say mental health issues, our mental health is a part of our overall health. We have to be honest about taking time out to actually check on each other. When I've lived in other cities, people would jokingly say, "Oh, you from New Orleans? Y'all always ask people how they doing, but y'all don't really care." And I was like, "No, we really do." Now, do I care to hear about everything that's going on? Maybe not. But when I see, I'm gonna say, "Baby, how you doing? You all right today?" Now, if you say to me, "Oh, doc, it's not good," I'm gonna say, "Well, sit down, have a talk to me. Let me know what's going on, what we need to do." But we need to. And so the first protective factor is we have to actually let people know that there are resources available that they can tap into that are, one, culturally competent. That's one of the things that I have to stress in all spaces that I go into. We have to make sure that individuals are culturally competent. Just because I'm a Black man don't mean I can work with a Black man. Though. Just because you're a Black woman, you work with a Black woman. You have to have done the work. You have to have done the training. You have to be in the space where you are competent and capable to assist persons. That's the first thing, culturally competent. So second thing, we have to ensure that the people in our communities who make these decisions understand the impact that these decisions make on the people in the community. So we have to continue to stress upon our elected officials, our judges, our attorneys, our DAs, our educators, our school boards, all the way up to the president, that these things are important. And lastly, we have to make sure we say it's important to ourselves within our own homes. As Sister Shauna said, within our own home, having to deal with her own history of psychological distress and issues, and then seeing it in her daughter, we have to take care of each other. And it starts at home. We cannot pretend and look away. I'm sorry, my daughter's 5. There will never be a day where she'll just lock herself in her room and daddy can't come in there and talk to her. I just got her out of my bed where she goes sleep in her own bed regularly.
Hey,
So I
come back.
hope that continues, right? But it was a little unfair because it was the pandemic, and so we ain't had nowhere to go, so we could sleep late, right? But I love the fact that we have to come back to understanding within our own homes. take it serious when people are having things going on. Do not just think about it as it's just them being a teenager. They're just upset with me. No, our kids, our family members have stuff going on. And sometimes you have to stand and say, hey, look, I care about you. I love you. I'm here for you. Tell me what's going on. You are not getting up from here until you tell. That's how my mom used to do me. You ain't going nowhere until you tell me what's going on. That's my 3 points.
Yeah, I agree.
Thank you,
with that.
Dr. Turner.
That's
And,
very important. I love it.
and
Awesome points. Yes. To me, the top four for me, three of them kind of belong together. You need to hear, listen, and acknowledge. That's the first thing we need to do. We don't need to listen to respond. We just need to flat out listen, which we need to start teaching empathy. You know, empathy is not me just knowing what you're going through or have gone through it. It's the fact that I just respect that it is, that you're going through it, period. You know, we need to understand that bullying, esteem building, self-empowerment, all of that needs to be embedded into children and taught during their 8-9 hour days sometimes, just like everything else. We can't continue to expect children to go to school, which is their jobs, and behave correctly like we're supposed to at children's ages with the problems that we're putting them through. If a parent is going through it, a child is going through it. Sometimes we get on social media and cut up, or go to work and cut up, or go out to the club, or wherever you may go. You're human, but we expect our poor babies to just go to school and deal with it and suck it up. You know, we can't do that. We need to make sure that they have adequate, like he said, competent resources accessible to them all the time where they are. If they are at school 8-9 hours a day, everything that they need needs to be in that school. So we need to absolutely hold school boards accountable to make sure the facilities are adequate enough to deal with it, because the children not gonna change. They're not. We have to meet them where they are and then lead them somewhere else. So that's my protective factors.
And I want to, as our time is dwindling down here, I want to make sure that we get to resources. I'm going to combine these two last questions. So what resources, and this is to the group, are you aware of across the state that help individuals in dealing with suicide? Resources that help individuals deal with suicide, and also resources for individuals coping from losing someone by suicide. So for those two, what resources can you share with the audience?
I'll definitely jump on that one. Bully Box is definitely one for every adolescent across Louisiana. www.thebullyboxpassion.com. They can go on there and not only access 988, but even the Louisiana Department of Education. So if their child is experiencing suicidal thoughts and ideations because of something that's happening at school, they need to know the right forms and how to get them, fill them out, and bring them to school. We try to incorporate that into the curriculum that we built. You know, the Bully Box is there. We have 232 Help. We have 988. We have clinicians, you know, like the fine ones here, and some that we partner with. The help is available. We just need to be able to get it to the children as much as possible. So that's how we try to ensure that every child knows that they are not alone ever.
And I want to, there are some survivor of suicide support groups. There's a really good one in Baton Rouge. AFSP has a healing conversation program where if you've lost a loved one to suicide, you can contact them via the website, and someone can call you and talk to you and walk through with you as you go through the whole process with losing a loved one to suicide. So AFSP does a lot of education and advocacy. So one of the things we can do as a community is to educate ourselves. So we have several programs that are free. We do Talk Saves Lives, where it's okay to talk about suicide. We have the It's Real for high school and college students. We have an introduction to supporting those at risk of suicide. So we have several programs that we do or can do, offer folks just to educate yourself about suicide and what you can do. So I'm throwing those out.
But I would say in higher education, most universities have counseling centers. That would be the starting point. And I'm going to speak just kind of from where I am. I think obviously that is probably the key to early healthcare, mental health care. Also, as a practitioner, I think most of our cities have some governing body. In New Orleans, we have the Metropolitan Human Services District. And I know that throughout that, we have Catholic Charities and we have other institutions and entities. Obviously, individuals' personal insurance or private insurance would be a resource. I think people overlook oftentimes that conversation with their primary care physician, or even if they can call the local hotline. So I think obviously for higher education, counseling centers on campus and resources there. And then also in the community, there's usually some type of mental health governing body that will see anybody. And I do mean anybody. I'm actually on the board, as stated, for Metropolitan Human Services District, which oversees 10 parishes in the greater New Orleans metropolitan area. So we have a 24-hour hotline that oversees everything from mental health care, addiction services, trauma services, or response to trauma services, as well as works with the police department in terms of crisis intervention services. So make note. And I think once again, as I'm gonna reiterate this too, within our homes, make sure that our kids understand 911 in terms of police and fire, but also what are the mental health care resources that can be available to.
And I want to add that, you know, with in like the Baton Rouge area, there's the Grief Recovery Center. There's
Yes, thank you.
Family Services of Greater Baton Rouge, you know, services that are on like a
Uh-huh.
sliding scale fee. Sometimes people feel like they want to get in some type of therapy or treatment, but they can't afford it. It would be a financial hardship. They work with people on a sliding scale fee. And then also, you know, getting in touch with your employer and finding out about EAP, that your job will cover those and you'll have a certain amount of visits. But those are sometimes under-tapped or underutilized resources that people aren't aware that they can use for them and their family.
Yes, and you mentioned VLink has a Real Talk. They partner with Grief Recovery for teens that are struggling with suicide ideation, somewhat of a support group. And then there's a parent line that assists with those. There's support for the parents of those teens that are struggling with suicide ideation. There is the Fisher Project that's for 18 and up that works with individuals to prevent suicide that are struggling with suicide ideation. Family Tree also does groups for individuals that have lost someone to suicide. We do have some trainings on our OBH webpage that we'll share with you. Those are QPR, Question, Persuade, and Refer, and START, that we can share those links to. And just wanted to touch on those quickly. And I know we're getting to time. So as we close, what is one thing you want the audience to take away from this webinar?
What I would say, go ahead, Ava, you go to time.
No, well, I just want to say something. I wanted to mention that when we were talking about impulsivity, that sometimes, I don't know if we touched upon the fact that substance abuse is a contributing factor sometimes, where people who may have been kind of flirting with the idea that once they are under the influence, intoxicated of anything that will remove inhibition, it may increase the likelihood of them following through on it. So that's something that we want to be aware of. And when we see someone's having issues with that, just, you know, keep conversations, just be willing to have uncomfortable conversations for the sake of comfort. That, you know, as long as you allow yourself to do that, you're creating a space where people can be open and honest and be able to get the help that they need.
What I'd like to say in a very quick and brief way is it's time out for us acting like our mental health is not central to our existence. I would even actually say that probably almost more important than our physical health is our mental health, because your mental health is the thing that actually kind of serves us notice on what's going on. So I would just like to say to everyone, hopefully the message I can provide is that take care of your mental health every day, whether that be get out and exercise, whether that be make sure you're de-stressing, however might be in a healthy way, because sometimes people think de-stressing is okay when you're smoking and drinking and eating and doing unhealthy things, but do it in a healthy way. Check in with friends, check in with people, let people know when stuff is going on. Make your mental health care a part of your everyday life. That's my point to take away from it.
And I'll reinforce that with saying physical health is health. We separate them like they don't have any connection to each other, but they do. Mental health is health. It's okay to talk about suicide and help the person thinking about suicide put time and distance between how they think they might kill themselves and the ability to act on that.
And I just want, if every child is watching, especially, and every adult, that if you're going through something, it's okay to say how you feel. It becomes not okay when you take your feelings and make someone feel any less. So if we could start getting out, talking to our children, that way our children will tell us what's going on. And that way we'll be able to stay in the loop and make sure that their mental health is just as intact as every other part of their health.
Yep. Great. Well, thank you all so much. It's important to increase, education and awareness surrounding mental health, so that we can have these open conversations surrounding mental health and increase help-seeking behavior. So just thank you again for the insightful discussion and for increasing education and awareness. And I believe the more that we openly talk about suicide, the more we can reduce stigma.
Thank you so much. I'm just going to pull the PowerPoint back up for us. Let's see. That was such a wonderful panel discussion. Let me see. I'm a one-man show today, so I'm trying to get everything together for our audience. Wonderful. All right, so we're just going to go over these key takeaways again for our audience here. But first, thank you so much, Dr. Thomas, Dr. Turner, Ms. Sayas, Ms. LeBlanc, and Ms. Brown, for your responses and for being a part of this especially important panel discussion. As community gatekeepers and providers participating in this discussion, each of you has helped to enrich people, populations, and communities' awareness, so thank you. It was such an impactful conversation, definitely glad to be a part of it. So for our audience today, we'll go over these key takeaways once more. So again, suicide is a serious public health problem that can have lasting harmful effects on individuals, families, and communities. Suicide occurs across all age, gender, socioeconomic, racial, and ethnic groups. Suicidal behavior is complex and usually not a response to one problem that a person is experiencing. And last but not least, suicide is preventable. Knowing the risk factors and recognizing the warning signs can help stop it from occurring. So one thing I wanted to do with everyone today, I know we're a little over time. Thank you for bearing with us. We'll be wrapping up soon. But since this topic was quite heavy today, I encourage everyone to participate in this brief breathing exercise in 30 seconds. Research shows that 30 seconds of deep breathing can reduce stress and anxiety levels. So let's get started. Just follow the instructions as they are presented on the screen. Thank you so much for participating. Let's see. I hope that this brief exercise brought a little peace to your day. Whenever you feel like you need to catch your breath or the world is spinning too fast, doing a breathing exercise like this from Calm or another resource similar can provide instant relaxation. So thanks again for participating. And now we'll continue to wrap up. I want to thank all of our attendees for coming and listening to this discussion today. And I hope that you found something enriching and valuable that you can take back and add to your discussion with your families and within your community. Please utilize the resource guide that we will be emailing to you after today's presentation. You are also encouraged to complete our webinar participation survey to provide feedback to BCPA team for future events. That will be included in the follow-up email that we will be sending after the webinar. And then once more, for those of you who may have Medicaid insurance, if you have medical insurance coverage from Medicaid, then you must make sure that your information is up to date. This includes your address. If you do not update your information, you may miss important letters from Medicaid and you could lose your health insurance coverage. To update your information, you can visit the self-service portal at www.ldh.la.gov/mymedicaid, or you can call 1-888-342-6207. And once more, if you or someone you know is struggling or in crisis, help is available. As mentioned today during our panel discussion, call or text 988 or chat 988lifeline.org to reach the 988 Suicide and Crisis Lifeline. And at this time, I will bring in the Director of the Bureau of Community Partnerships and Health Equity to close out our webinar. Devondra.
Thank you, Ayana. And one last thank you to all of the panelists of tonight's webinar. While this conversation is a solemn one, it is essential, and hopefully the information shared was both empowering and encouraging to be a participant in preventing suicide. I'd like to thank the staff of the Bureau of Community Partnerships and Health Equity, the Office of Behavioral Health, and the Bureau of Media and Communications for executing such a needed conversation. A huge thanks goes to the entire Louisiana Department of Health team. And last but certainly not least, a special thank you to the Secretary of the Department of Health, Dr. Courtney N. Phillips, for her continued leadership in pursuing a healthier Louisiana. Please join us for our next conversation focusing on Breast Cancer Awareness Month on October 19th at 5 p.m. You can use the QR code on your screen or go to tinyurl.com/LDH breast cancer web to register for our next webinar. This will conclude tonight's event. Good night to you all. Take care of yourself.